just to bring you back to the letter guarantee of payment.
Yes.
From NHIF, how much were they committing to pay?
It's $5,000. So that was coming to approximately 400 and I don't remember, it was 450,000 by then.
This is last year?
Kenyan shillings, yes. Okay. By the time they issued the letter on 20th July 2024.
$5,000.
Yes.
And by that time, you've already done 60,000.
Yes.
Yeah.
Because what the hospital had told you to pay initially was over $50,000, isn't it? 5 million, 6 million, that's a $60,000.
Yeah.
And the insurance is saying they're going to pay 5,000. Just about 10% of the bill. And that's all commitment that they can pay.
Yes.
Was it like partial, or was it, this is ile pesa yote tuko nayo mbele na nyuma? You know, they say mbele na nyuma.
That's the package. So even before they communicated officially, I had talked to a few people and I knew we were to get a maximum of $5,000. Yeah.
So you have to basically get the rest of the money.
Yeah.
Now, you had said that then they, when you were called here by somebody from SHA,
Mr. Ibrahim.
Ibrahim from SHA, they told you that this one we can sort it out. We can pay the hospital and then you seek reimbursement from the hospital.
Yes.
What option did you go for? What was it? Was that the only option?
Okay, there was a challenge because they said the hospital would have responded to the email and officially communicate that they will not utilize the GOP. But they didn't do that. I'm actually the one who was kind of pushing for that communication. And I remember talking to the hospital. For the money to
come out of SHA, the hospital needs to respond.
Yes, they needed.
And acknowledge the GOP.
Yes. And maybe send an invoice later.
Right.
Yeah, but they didn't want to go through that process. So they decided to ignore. So but they communicated to me that we will not accept it because of 1, 2, 3.
Because we have pending bills with the previous institution called NHIF.
And they were quite clear, that is between you and NHIF. It's your institution. For us, our primary role is to take care of the patient.
Did you informally tell Ibrahim this?
I did.
So what did they say?
That's why he was trying to kind of fix the case by pushing for a payment directly to the hospital. Then that money would either be utilized for the post-transplant care and maybe whatever remained, they would refund to us to take care of the rent that we used to pay. Yeah.
And then I remember we even had a conversation with you on this show, you know, when you called. I think they were supposed to still continue to make a follow-up. Tell us what happened after that conversation took place on this program.
A few days later, actually I think 2 days before the burial, I realized nobody was talking to me, so I called the acting CEO and he connected me to a lady. I think she's in charge of communication. So that is the person I've been communicating with to date. So they requested that I do a formal email explaining the details of what transpired and my request, because they were to do a report and present it to the board for an approval. Because their policies, the way they are sitting now, they do not allow a reimbursement or a refund to an individual. They can only pay a hospital or an institution.
A contracted facility.
Yeah. So in this case, the request had to be approved by the board.
Okay.
But now, I sent my email on 7th of March, but to date, we're still waiting for the board to give an approval. So that is why I started by saying I have an issue with timelines. Because if that money was to come and help us maybe pay part of the bill, or maybe help settle some of the debts that we got ourselves into. Because yes, the baby is gone, I am no longer working, I have loans to pay, and all these loans I borrowed to take care of this girl. And this money, it's quite a significant figure. It may not be much, but it can help to take care of some of these debts. But now, from the look of things, nobody knows how long we're going to wait for that approval. With the ongoing changes, I don't know whether this will be another forgotten case, and I don't know who to follow up with.
With all the transitions happening in the ministry.
But at SHA, the board is intact. It has not been changed.
Yeah.
The only thing that has changed is the acting CEO, Batingasira, has been replaced with a new CEO, Dr. Massimo Ngangi.
Yes.
The communication manager that you're talking to is still a communication manager, is she not?
Yes, she
So
is.
she's still there. So everybody who knows about this case is still working for SHA. What you're waiting for and what you were told by the comms manager is this matter is now being presented to the board for the board's approval.
Yes.
No indication when the board is sitting?
No, I may not know.
Nothing at all.
No.
So there's no now further communication that we expect that the board is going to sit in the next 2 weeks, in the next 3 weeks, in the next month, in the next quarter. You have absolutely no idea when this will take place.
I have no idea. And you know,
or whether it will take place.
Or whether it will take place. I mean, you try to follow up, it's
and
quiet.
actually my worry is, you know, this case has been discussed on so many platforms, so many times. Why is it so difficult to grant that approval? Because it's to me, it's a straightforward case. Because at least they shed some light saying the approval can only come from the board. But looking at the genesis of the case, we have provided all the documentation required. Why is it so difficult to grant that approval? And for how long will it be pending?
And for them to not just explain if there's a hold up. It's interesting, just as we come back to you, Mama Arianna, Grace Mule, who it was covered in the news. She's actually sent a comment on YouTube and she's saying, my name is Grace Njoki. That's why I went to the press conference in the Ministry of Health. SHA isn't working. We remember when she was highlighted, really speaking on behalf of many who are feeling that frustration.
Yes.
And so you're saying right now there just hasn't been any communication, so you don't have a way forward.
I know.
No.
And you know, it's tiresome to keep on making those calls. Sometimes they are picked.
Sometimes they're not.
Sometimes no response. And I can only imagine, I'm lucky that I got such a platform. We are discussing such a matter. How many Kenyans out there do not have a clue of where to begin or where to start?
Eric, we've discussed many of these SHA issues on the show before.
Yeah.
What do you think is this main bottleneck? Is it that they are talking about using the backlog of resources as an excuse? Is it miscommunication, poor communication? What is it?
I think the bottom line here is just poor communication, right? Even when you had Robert Ngasira, who was the then acting CEO, when you called and spoke to him on air here, he said, this is something we can pick up and follow up. They should not have waited for you to call them because we gave them your contact and they had your contacts. They should have called you immediately, right? That's just area number one. So you called them after 2 weeks, or was it 3 weeks?
I think not 2 weeks, a few days later.
A couple of days after the show, you then called because we also gave you the contacts. So you call CEO and CEO says, all right, so let me just hand over this to my officer so my officer can do the things that I've instructed her to do.
Yeah.
Since then, you are just not getting a clear way forward. I think it's a communication issue. Because even the chair of SHA, who was online on that day, Dr. Abdi Mohammed, he listened and he said, yes, we can sort it out. This is a matter that can come and we can see how we can sort it out. It should be that. These are those cases where the Social Health Authority shows that we are more proactive than the other guys. Right? One of the things that the reason why we are changing is so that we can be nimble in our decision making. We can be proactive in our decision making. Come in here and say, this is a clear case, it's documented, this is what happened. Unfortunately, the facility has not done what would trigger a payment from us, which is acknowledging our guarantee for payment and also sending us an invoice. But despite that, we know this case. We have all the documentation. We can take care of it this way. But, you know,
communicate, even tell her we're coming back to you, but if you keep calling and you're not getting, it's even hard to move forward, right? I'm sure it just leaves you feeling a bit stuck.
And even for the staff that I've been talking to, it's also difficult for her because I can only imagine what
she doesn't know what's going to happen.
Yeah, whenever she sees my call, because she has to talk to me, but she doesn't know when. So they're still waiting.
Minister Njue Victor Moses Kuri had also agreed to help out from the last discussion through the phone call. Did he keep his word? What commitment did he make? And have you heard from him? He made a commitment.
Moses Kuria said here that he's speaking on behalf of the government. We're going to stand with Mama Arianna and so on and so forth. That yes, the government of the Republic of Kenya will not let you down.
I've never heard from him. since then.
Okay.
Yeah.
Moses, you made a promise and everybody had it. You'd like us to look for the clip? We'll play the clip. And we asked, are you making a commitment? He said, yes, the government of Kenya. Moses Kuria, you made a commitment. You have not followed through. That's one.